Good morning to one and all. Thank you for coming here on a Sunday morning. It is really incredible to remember when I started working in alternative medicine 23 years ago, after many years working as a traditional doctor, and the cause was a health problem. And I worked as a doctor, and it was thanks to natural medicine that I was able to solve my health problem. That was 23 years ago, and I started studying acupuncture, then homeopathy, and after many, many years, everything that I found interesting was something that I started to work on. And in fact, I was looking for the perfect solution, but I never found the perfect solution. However, based on my humble experience, I can conclude that health is based on the consistency between what we think, what we do, and what we feel, because we think with the left hemisphere, the hemisphere of logic and reason. It's the hemisphere of judgment as well. We feel through our right hemisphere, the hemisphere of emotions, of feelings, of intuition, and of understanding. And we act through our body. We need a healthy body. Mens sana in corpore sano. That's how it works. And it's this way of thinking that has established the basis for our method, the method we use to work, that has increased the quality of our service and that has reduced the time for healing to achieve healing. And this method does solve most of the health problems that we see today. Because our patients, your patients, very often, sometimes they just want a bonus. They just, because they are already in the system of traditional conventional medicine. I'm talking about patients who have degenerative chronic diseases, cancer, and they just want this bonus, a plus that helps them improve their mood, their health. Other patients are in a better condition and they can choose, and their choice will depend on what they know and what they trust. Someone who has an allergy can choose an antihistamine or a corticosteroid, but this same person can decide to use another therapy like orthomolecular therapy. And what I like best is the preventive medicine, because I remember, and I have a colleague here from Galicia who reminded me this, because some years ago we had this work by Andres Moris, and in his books published these new ideas, and many people would come for a colon hydrotherapy because they were already doing some liver cleansing at home and they were going to courses to learn. That's what they wanted to do. They wanted to learn. And the fact that we can help people by giving them information, by teaching them so that they can start their own preventive medicine is very important. And today I'm going to be talking about psychosomatics, the influence of the mind on the body. I'm also going to talk about gut hygiene and colon hydrotherapy as a method that's indispensable for our health. And I'm also going to talk briefly about microbiological therapy. From the beginning of humankind, we've always tried to find the origin of disease. It has been because we've always understood that the disease was due to our conflict with divinity. We have this memory that disease is a divine punishment. Patients ask us all the time, why is this happening to me? I don't deserve this. Why is this happening now? We still believe that disease is a punishment. And the father of medicine, Hippocrates, included among the origin of disease any environmental changes such as the temperature of the climate. The Chinese say that energy alterations are in the origin of all diseases, and we have these invisible waves from mobile phones, from electricity, from Wi-Fi and genetics. Not so long ago, we heard about genetic engineering as the way of solving all the problems. And we have epigenetics that says the gene has not the power to self-express itself. It needs the environment to give it a stimulus. And this makes us feel very humble, doesn't it? Today, we are going to be talking about psychosomatics because it's a trend today, but we'll start talking about Freud, who in 1895 in psychoanalysis already created the term of the unconscious to talk about all those things that move our life and that we don't decide consciously. In the unconscious, we have the transgenerational memory, what our ancestors lived up to 3 or 4 generations before. And what we have lived within our mothers is really incredible to see what we live when we are in our mothers. Mainly because we live what happened to her and how our mother experienced things. And this is in my neuronal system. And then there are things in our life that activate these memories. And we have in our memory, all in our memories, what we've lived and what comes from our past, our animal past, particularly in situations of survival, because they can save our lives in situations of life and death. And we also keep our beliefs. I'm going to tell you a story now to wake you up. I had this young man who came with his parents to the clinic. He's a teenager who didn't want to go to school. He had always gone to school and he was happy to go to school, but then I asked him, why don't you want to go to school? And that was February, and he said that in September there were some new boys at school who would push him around, insult him, and my patient, this young man, was very athletic, and I said, well, if they push you, you push them back. And he said, no, I'm never going to do that. And what he says next is very important. He says, look, doctor, it's better to be a coward, but to be alive, but to be brave and be dead. And I thought, oh, that sounds strange. And the reason why they would insult him and push him around and bully him is because his dad was a politician, and a well-known politician, and as they couldn't attack the father, they were attacking the son. And the great-grandfather of that young man, during the Civil War, he was persecuted, and they were doing some renovation works at home, and they had this cellar built under the kitchen as a hiding hole so that he could run away from the danger. And after the Civil War, he couldn't come out of his hiding place in the basement because the situation was still dangerous, and that man died in the basement. And that young boy that was born on the same day that great-grandfather died, and he had the name of the grandfather as a second name, and so in a situation of danger, he feels that he has to do the same as his great-grandfather did or grandfather did. He has this memory that's activated in a situation of danger. He does the same. He hides and does nothing. The unconscious always has an intention and a purpose. The intention is always to save your life, and the purpose is to give you what you need when you need it. And I'm saying what you need, not what you want and what you like, but what you need, what the unconscious feels that you need. For those of you who are not familiar with psychosomatics, when you see a patient, you should always ask yourselves a question. Also in life, but when we are talking about disease, we have to think, what is the benefit of this disease for this person, or what damage is this disease preventing for this patient? And that will give you a lot of information, because when we go beyond the limits of homeostasis, what's tolerable in life, then we have a symptom. Symptoms can be expressed in many different ways. They can be expressed in our biology, because our biology shows all those blockages, all those feelings that have been blocked and that are in the origin of the disease. I'm going to tell you a case that will allow you to understand much better. I had this patient who came who was obese. For 3 years, she had been working under a lot of stress, and she said that she took care of her diet, but she was gaining weight, but she had lost her job, and she was gaining a lot of weight, and she had been out of work for 3 months. And when I asked her about the stress she had the 3 years before, she just said that she was working a lot. And well, so I kept on doing things. I prescribed a colon hydrotherapy, and my nurse told me that while she was doing the colon hydrotherapy, water go in and water would come out and nothing else. And the idea is that when we have a colon hydrotherapy, we let our patients speak. In fact, we favor that. We just want them to speak, whatever the topic. And then suddenly she says one word, and the word was harassment. Harassment was the word, and she started talking about. And when she came to me after this colon hydrotherapy, she said, "Thank you for the colon hydrotherapy." And then she said, "I was wrong, doctor, because my belly has spoken to me. My gut has spoken to me. And I know that I was wrong. During those 3 years at work, I had a boss who was harassing me. And I thought that by keeping quiet, that was the best way of keeping safe. And that's what I did. I kept quiet to keep safe. But when I saw everything that came out that tube during the colon hydrotherapy, I understood that I was intoxicated on this inside. I was rotting inside. I was rotten inside. And she thanked me for the hydrotherapy, and then she asked me the following. Now I understand why I put on weight those 3 years. Why am I still gaining weight now that I'm out of work? And I explained her why. Because she would see her boss half an hour a day, and her unconscious had to be alert half an hour a day. And you know that obesity is a way of protecting ourselves. And when she decided to leave her job, and she didn't get any compensation, any unemployment benefit, no recommendation letter, nothing. She couldn't find a job. And how many hours was that predator, that boss in her mind? Then 24 hours a day. And her unconscious was responding to this information, because our unconscious does not differentiate between what's real, what's actual, and what's imaginary. And this is wonderful for us as therapists, but we have to take it into account, because if we don't take into account all this information, a lot of disease can occur. And it's also important when we talk about traditional Chinese medicine, we can have symptoms in one organ and the cause can be in another organ, not in just any random organ, but following the principles of traditional Chinese medicine. It's important to think about this reference because this is something that I often see. And in our unconscious, our unconscious can express itself through relationship conflicts. I remember a homeopath teacher I had who I admire greatly. Every time I used to complain about something, about my children, for example, who have become my teachers, she always used to say to me, the other person is not the other person, it's you reflected in the other person, it's your mirror. I didn't like to hear that, but it's true. We always choose relationships that follow our ancestral memories. Pay attention to your partner, and very often you think, what he is doing is what my father used to do, it's what my mother used to do, or whoever our reference figure is, our motherly or fatherly reference figure is. The unconscious also expresses itself through identification, through a love that is not well understood. And we give up our lives to be a bad copy of that other person through identification. What the other person is suffering, we show it in our bodies. Who does this all the time? Well, babies and children. All the diseases that we see in children are due to family conflicts. At home, there is trouble, there is angriness, there is cough, then there's bronchitis. For example, the constipation in babies and in children made me suffer a lot because homeopathy worked, but it was a long treatment. But now that we treat the mother, when we treat the psychosomatics of the mother during the period of pregnancy, I can't say we cure 100% of the cases, but I can say we can cure 99.9% of the cases, and we're really happy with this. How can all this be solved? Well, by becoming aware of all these things. And this is not just something that therapists say. Also, scientists such as Rupert Sheldrake or Capra, who represent the new scientific paradigm, confirm this. They talk about consciousness as the integration of the two brain hemispheres, of the consciousness and the unconsciousness, of reason and intuition, of judgment and understanding. We know that everything that we judge speaks about our ignorance, and when we understand it, we grow, we live. Because if not, we're just surviving or dying. Additionally, we know that never are we going to find a disease or a deceased person who has no intoxication inside, and we know that this gut hygiene can help us cure this intoxication because we have this intoxication due to all the pollutants, the environmental communication. We have water we need to drink because in the US they love statistics, and there is this chronic dehydration of 75% of the population. And I think that here we see the same, and this silent disease, chronic dehydration, will lead to other diseases, and we must always bear it in mind. And how can we cure this? Well, by drinking. We have to insist that we should drink good quality water. We have these devices that help alkaline water, and this will help with the detoxification of our body, because this is what we need. And I'd like to mention Dr. Luc Montagnier, now that we're talking about water. And Dr. Luc Montagnier is a traditional doctor who received the Nobel Prize, the Medicine Nobel Prize, because of his studies on HIV. And then he did other scientific studies where he proved that water fixes information. That's something that homeopaths already know. The water fixes information and communicates information, and to use the power of water is very smart, because Masaru Emoto, we saw some images in the previous presentation. We know how water can crystallize, and the crystals that you see on the right respond to a water that has been informed with vibrations that have to do with love, beauty, and health. And the other water on the left has been informed with toxicity. It's water, in fact, that comes from a Tokyo river that has lots of residue. And we mustn't forget either that our self-intoxication has to do with the metabolic residues of our digestion, as we've already heard in other presentations. And we're ready to be able to resist the contamination, but for this, we have to have the power of secretion. We have these minor filters and these large filters, the skin, the respiratory system, the digestive system, and the kidney system. Today, we're talking about colon hydrotherapy, and all our patients have filters that are not working properly. And if with colon hydrotherapy, we have the power to clean at least one of the filters, the one that can secrete the largest number of toxins, it's important to use it, because the colon hydrotherapy allows us to eliminate all the toxins in the large intestine. Because even if we have a good diet, there is that barrier that doesn't allow all those nutrients to get through, and it can eliminate all the pathogens and all the parasites that secrete phenols, lindols, scuttles that goes into our bloodstream, into our liver, and our liver has to metabolize all this. And sometimes we go crazy with our patients' headaches, and we see that many of the headaches have their origin there. And we mustn't forget either, as our colleagues have already mentioned in previous presentations, the autonomous nervous system, the sympathetic one and the parasympathetic one. The sympathetic one is governing stress, whereas parasympathetic one is governing sleep and calmness. And it's impossible to have a good colon hydrotherapy if we haven't activated our parasympathetic nervous system. And for those of you who don't have the device yet, it's important to have colon hydrotherapy done in a room that's calm and quiet. You cannot have a nurse coming in and out. It's nice to have music, maybe some images, to have a nice therapist with a nice voice, a nice smile, with nice hands, so that we help our patients relax and we ask them to speak. Because when they start speaking, they start activating their parasympathetic nervous system, and in that way we can have a very good colon hydrotherapy.
Efectivamente.
Exactly. I think we are now in a moment where interest for health and natural medicine has increased. It's our moment to take advantage of that and to implement it. Therapeutic and medical action is to prevent and then to cure, but it's something that stands out. How have we done this healing along the years? It has been depending on the scientific thoughts and knowledge until today, from Hippocrates, Rudolf Virchow, and so on. Medicine was, in those times, purative, derivative. And why? Because we were talking about a medicine where we were thinking that pathology was in the fluids. It was a disorder of the fluids, a humoral disorder. It's in the 19th century, Rudolf Virchow creates the cellular theory, and we start to think that the whole medicine starts to focus on cells and tissues. But 1 century later, it's not doctor, it's a physiology and scientist, Alfred Pischinger, who talks about the basic regulation system, that's the interstitial tissue. And as you know, as such, it is cooperating, communicating, cohesion, and so on. It's a tissue where we deposit our toxins. So we have to give it the importance it deserves. We have to go on with the medicine as we started it. Also, Bernard Aschner, I would like to remind him, rheumatologist from New York. In his youth, he translated a lot of handbooks and also the Paracelsus book. And then his knowledge was used in his treatments in traditional medicine. And he detects that diagnosis improve, not the healing, but the improvement, we could say. And very often you can reach healing or the cure. I would like to give you or tell you a story. He has a very big work, written work. He's traduced into German and they received this information much earlier than we. And we see that a lot in those northern countries. They acknowledge these kind of therapies. I remember years ago in a congress in Germany, I was participating in a congress. I was much younger, and the doctor was talking about the different suction systems, and I was talking to the gentleman next to me. I told him, look, what we have been paying for it, and this man is telling the same as the medicine man from my village. He stops his presentation. He says, Miss Gómez, the medicine man from your village don't know how to use the suction cups I'm using, but he was not right. So he had understood the Spanish I was speaking. But our medicine man and all the healers we had in our village know how to use the suction cups very well. But not only the healers, also our grandparents, maybe not our parents that use the enemas, but our grandmothers used enemas and also garlic soup and onion soups, and your grandmother would cook also the different essential oils we were used to, like cod liver oil, for example. So this curative medicine was well known and embedded in our ancestors, very close ancestors, our grandparents. I remember a professor said that disease an expression of biology and is intent to eliminate toxins. So the fact that we have inflammation, edema, fistula, pain, and so on, means a kind of expression of trying to eliminate the toxins. We only remember that we have a health when we lose it. But what is a doubtful fact is when you have an intestine that is not functioning well, it's the best basis fundament for a disease. It's the same as when Hippocrates said that all the diseases start in intestine. And we confirm this statement when under the title you see on the slide, Qui bene purgat bene curat. Of course, we confirm it with our colon hydrotherapy. It allows us to cleanse, eliminate toxins, and the control of temperature, pressure, hygiene. It's all very well controlled and acknowledged. But it's not only a good diagnosis tool. It also allows us. What does it allow us? It allows us, it's not only a good therapeutic tool, she corrects herself, it's also a good diagnostic tool. We can see the food that has not been digested, we can see gas sacs and so on. And I bought my first colon hydrotherapy device. It's several years ago. And I remember that in one of the congresses I attended, there was one of these devices we could try out. After the discharge, the first discharge, the technician, the operator was German. He said, I'm feeling a very strong pain in my second colon. But the therapist said, no, it's not painful. I said, no, maybe it's not painful, but for me it's painful. No, the therapist said it's not painful. And I was feeling again, I feel it, and he said, no, that's not possible. Very German, the therapist, and the operator, no, it's not painful. So we were discussing my pain. By the third one, I would say the third try, if it is painful, we stop. And the third one, and then I was really, really shouting because it was really very painful. I look at his face, I see the face of the operator, and what was happened? I see a melon seed coming out like this. Melon seed. Excuse me, peach. I think she said peach seed, which is very big. It's like a bone. No, it's well, that came out, and it's something I ate when I was a child. Maybe it could have caused an abdominal perforation, and with the treatment, it came out. No, I'm talking about 20 years ago. The colon hydrotherapy was not a very common therapy, but Isabel Preisler is a very famous lady here in Spain. She was the ex-wife of Julio Iglesias, the singer. And I was reading a magazine, and she's a real celebrity. And hola, the hello, you have it in the UK also. I was reading that. And I was reading an article where they're asking, why do you have this peachy skin? And she said, well, I undergo colon hydrotherapies. And at that moment, the interviewer didn't know what she was talking about. But I knew. But so it is really very, very interesting how everything is linked. And it's also the influence on the lymphatic system. It's also important to take into account imagings for the diagnostics and the preoperative stadia. I remember a private sanitary where the nuns were working, and I remember them telling me, why do your patients have such a good post-operative recovering? And, well, that's the reason. And you know that the CHT device has a valve to take samples. Well, I remember buying a centrifuge and also a heater. We have centrifuged the sample, and with a microscope, I also have for other things, I see the sample, and you can see if there are microscopic parasites. We also put it in an agar plate, and in 24-48 hours we know if there is candida growth or fungi and so on. So it's very rapid, it's cheap for us and for the patient, and it gives us a good diagnosis too. 31, it's Dr. Otto Heinrich Warburg. He receives the Nobel Prize in Medicine, but that's not the most important thing. He obtains it because he proves that all the cancers, without exception, there is acidosis. And what happens there? And also hypoxia. Is that only in the cancer cell? No, with the germs the same happens. You know that if there is no acidity, not even flies can grow. But if there is pathology, all the diseases and cancer cells grow with this dirt and with this acidity, and they kill us. So oncologists, during the chemotherapy periods, and they change the chemotherapies every day, they don't want to hear anything about any kind of substances that can interfere in their chemotherapy. So I think it's our moment now to use all the hygiene tools we have to our availability, so that we don't interfere with their substance, with their agent they use in the chemotherapy, so that this active ingredient does not interfere. What we do is colon hydrotherapy with a higher frequency as normally. We change the diet also, which is not the issue here, but I think it is essential. Then ionized alkaline water. You know the different hygiene means we all are familiar with. And then we pass this transient period. These patients are very tired with a lot of fatigue. A cancer patient, to add additional treatments is a burden, because they have to carry already a very strong load. They need a family and relatives to give the support. Very often they have to treat their cancer, and with a natural medicine, against the opinion of many people. Due to lack of time, I won't go into details, but I think we all agree on that point. It's more or less in the last century, 2 centuries ago almost, Louis Pasteur, Robert Koch, and then our previous century we had Dr. Rouge. They talk about microbes, bacteria. The first of them talk about it's the origin of the disease, and then last century, starting with Dr. Rouge, they start as the system of defense. If we talk about microbiology or biologic systems, we talk about microbiologic therapy. It's curing and healing with bacteria, with physiological bacteria. We know that we are, in fact, a macroorganism which is made up by millions of cells. So a macroorganism directed or managed by the microorganisms that have generated us. So we have to respect them. We know also nowadays we're now in the era of antibiotics. They reduce our capacity of defense. We know that since 20 years there is no new active ingredient anymore. And also at this moment, a lot of the diseases cannot be treated with antibiotics, and a lot of germs do not respond to the already known antibiotics. And what's even worse, the germs that were responding in the past have created their resistances and do not respond anymore. So human being has created an environment which is very proliferative for the growth of these kind of microorganisms. So I have to face the situation, and it's not an opposition. We should be cooperative with the diseases and the bacteria. We know that if we are treated with antibiotics and we have an effect on our immune system, and this secondary effect can be avoided if we take also probiotics. And through the laboratories COBAS, we have a study which is qualitative and quantitative of the microflora. But you know that we know many strains, a lot of microbiota, but there's a lot of microbiota we do not know. We normally talk about microflora, the producing one. Here you see it in blue, but also the nutritive, the nutritional one, it's light blue, and the immune modulating one in the green color. And of course also the pathogenous microflora, which only is pathogenous when it overcomes certain thresholds, fungi and bacteria in green also. This microflora has a very important, enormous influence on our health system, health structure. I go too fast, faster than the text I have. So we get the information. What kind of information do we obtain with this knowledge? It gives the information about how the mucus is working. It's of course very important in so many diseases like the irritable bowel system, ulcerative colitis, and so on. So even specifically, we don't give probiotics just by chance. No, we use this test to see what kind of microbiota could be administered to this specific patient, how often, the frequency, how much, and so on. So the treatment is normally done in 3 phases, always guaranteeing a correct diet and hydration. First phase, we clean the body during 7 days, then colon hydrotherapy can be 2 or 3. In the second phase, we incorporate the prebiotics, and in the third phase is where with the prebiotics we add also probiotics, but individualized, customized, adjusting it to the patient. And we guarantee also acid-alkaline relationship. Yesterday we have talked about other processes. What we do here is these auto-vaccines with the feces of the patient itself. Let's remember that until nowadays we had a monocausal reason. So we had a germ, a disease, and a cure. It's much complexer now. We have accepted as a polycausal situation. So we can also use multi-therapies. What you see here is everything we use in the center, the medical center, I manage, I run, but always following a coherent protocol. I think that you will agree that medicine nowadays, with the preamble of the future, we are not doing what our predecessors were doing, just a disease and a pill. No. And if it is worse, surgery. No, we need to remember and teach our patients first. Health is the responsibility of each and one of us. We cannot give the responsibility to the doctor, to the sanitary staff. You have to be responsible for your own status. And that disease, the manifestation of our internal disorder, lack of order. We know that what we have, or what we load externally, is expressed externally. I think that we have to change or redefine our praxis so that we talk about detoxifying periodically. I think that every day we see a growing life expectancy, but life quality is in fact not improving the same. So we need, and I repeat again, regular detoxifications, and we need it. Changes in diet, hydration, sleep patterns, exercise, and of course manage our emotions. Delphus Horka already said, man, you have to know yourself. And we doctors, therapists, and the whole sanitary staff are the ones who are available to patients. We have the duty to tell the patient that they have to understand the disease. The person must understand, what does this disease tell me? That's essential to be able to achieve a healing. Well, the first time I heard what I'm going to tell you now is a great truth. The first medicine any patient takes is his doctor or therapist, and we can be beneficial or damaging, and we have to assume this responsibility. We are the first medicine for our patients. The good news is that there's a lot to do, and I just would like to encourage you to do it also. Well, they sent a telegram when they are selling shoes to Africa, and he says, no, we don't need shoes, nobody's wearing shoes. And the one says, well, then you have to send more, because here we are not wearing shoes. Then, so if they are not wearing shoes, send more. We can sell much more because they need the shoes.
Bueno, turno de preguntas.
Any questions? We have time for 2 questions, more or less. Good morning. I would like to ask you, because you are focusing all treatments of colon hydrotherapy with a generalized hydrotherapy, but the pathology of the intestines maybe could have also contraindications. There must be certain diseases where it is contraindicated to use colon hydrotherapy. Well, that's a good question. I think that I have guaranteed that we don't only use colon hydrotherapy for digestive tract. We also use it, let's say, for almost everything. For almost everything, because I've discovered something. I'm going to take advantage of your question to explain something else. I've discovered that, for example, when you are treating, well, this is a specific case, well, many cases I have, mostly of obsessive syndromes, obsessions, psychosomatic obsessions, and with multiple psychological and psychosomatic therapies are maybe not solved. I discovered that when I could really change the whole system with colon hydrotherapy, the person was replaced and I could work differently with that person. So, in fact, telling you that the symptom is maybe not digestive, there is a digestive origin, and even more when you work with germs and parasites. Because if I have a patient with parasites, I say, what is parasitizing you? What is allowing to receive this parasite colonization? And so we work a lot with digestive tract. And a lot of people come to our practice telling us, I have a stomach problem, I have an intestine problem, I have candida, I have parasites, and so they come with this diagnosis and we treat them. So the indication for digestive pathology is always when it's not contraindicated. What does that mean? We always have to clean the intestine, except for contraindication. There are a lot. For example, there is a closed surgery, for example, with an anal fistula, or because in an irritable bowel. The moment they come to the practice with stress and acute crisis, they don't do it. I carry it out when they are relaxed and calm, not during acute crisis. Irritable bowel, Crohn, ulcerative colitis, and so on. No, not during acute crisis. We don't touch it. But when they have recovered of the acute crisis, then we treat people with these patients with colon hydrotherapy. We are very precautious. We are not in a hurry. The person is there. The person is going to listen to you, and we'll do it in the near future. And men are a bit more like this. We explain it perfectly, and no problem. Women, it's a bit easier. Pathologies, liver, pancreas, it's an obligation. It's really your duty to carry out colon hydrotherapy. It's not so much a question of what kind of pathologies we do it or not. It's more what is the situation, the situation or the status of the condition of the patient. We always think about it because it helps us a lot, because it's it will facilitate the success. The patient is going to help. The patient will be helped, but we will also be helped because we accelerate the recovery and healing time. So we use it normally as a support, the same as when you talk about a massage, we use it really a lot in this way, but not during an acute crisis. For example, cancer, when he is going to undergo surgery, he has just had the period of chemotherapy. We use this small period of time, this brief period of time in between, because we know that then 1 or 2 years we won't be able to do it. So a person where they are touching or they are doing surgery at the abdomen, we cannot do it, we know it, or before or afterwards. But in our mind, we have to see the convenience and the good results we obtain in all the pathologies with colon hydrotherapy, and doing it as I've told you before. Last question. Yes, good morning. A brief question. Auto vaccines, do you prepare them yourselves? No, that's laboratory work. In fact, they say that will be the medicine of the future, but it's very much an experimental phase. I've heard yesterday several things of people who is taking the feces of others, I think a bit heavy, no? In fact, but if you do it with your like a kind of auto-vaccine, auto-intake, I mean, that is with urine mixed and so on. But it's laboratory. And so you send it to the laboratory as Lola. Lola will explain it correctly. A very brief question. Last one. Hello. Good afternoon. We come from Mexico. I would like to ask you the following. And maybe if you could share with us. We have done it in Mexico empirically, treating oncologic patients and taking advantage of those periods, brief periods before surgery or radiation and so on. When you're during the chemotherapy, we have carried out colon hydrotherapy. We have seen that the response of the body is much less aggressive or violent. My question is, how beneficial is it that these patients could take advantage of the treatment? Because I have seen controversial opinions. There are people who say that it's okay, that's beneficial. Others say no, because it interferes with the treatment of chemotherapy, and chemotherapy is not going to have the success we expect. I would like to know what your experience has been. I think that active ingredient, enzyme, vitamin, and so on, I think, and I understand that the fear, the concern that is going to interfere with chemotherapy. But colon hydrotherapy, well, this is recorded, isn't it? You never know where it ends, this recording. When you are carrying out colon hydrotherapy, you are discharging this person of the toxin residues. You are not interfering in the effect of the chemotherapy on tissues, cells, mesenchymal tissue, and so on anything where it is acting. You are not interfering. If I talk as a person, what do I think about HT. Then if I talk as a doctor without knowing what colon hydrotherapy is, then I should have the same opinion as a person. What I mean with that is not only because I'm a doctor, I have more knowledge of something I have not practiced or used and so on. Not only because I'm a doctor I know about that. That's the fact. Pilar, excuse me, but 90% of doctors who criticize do know anything about colon hydrotherapy. When you ask them, but then tell me, what's your opinion? What is a colon hydrotherapy? They don't know what it is. Okay, I agree, but maybe they know what it is, but it depends from the perspective. The perspective is not the correct one. So people should know better, in fact. I understand that in the minds of people, the white coat of doctors is important. It has an effect because it gives you a kind of security. You feel comforted. You give them part of your trust, and as a patient, you know you need that. And it's our position, our role to accept this responsibility. So, if a white coat says something and another white coat says something else, and the therapist says something else, it's terrible for the patient. So I think that the first thing is the respect for the patient, respect for the person at that moment. I like that idea of patient-impatient. Respect for that person because he has a disorder in his life. He has a disease. He is lost. He doesn't know what to do. And any of us can go that way and need someone who gives the security and gives support. If I'm a doctor and I have a white coat, that is my role. That person is even going to pay for that. I have to assume that responsibility. You must, I think, always like this. And it's not bad at all to acknowledge that there is something you don't know about, that you have a lack of knowledge. For example, the chemotherapy. Maybe I don't know the active ingredient. They are changing every day. So maybe I can tell the doctor or the patient that maybe, okay, vitamin Of course, I'm not going to give anything that could interfere, but colon hydrotherapy or a suction cup. Well, the suction cups, well, when you talk about the suction cups, you cannot imagine the reaction you trigger. But, for example, clay enemas or clay pads also. And then the situation of the patient. It's very important. The patient should know that we are thinking, are caring for the patient. And we have to have enough knowledge and also experience to be able to move, no, and to understand the disease. But if you have clear ideas and a clear mind, well, I have very clear opinion that colon hydrotherapy is going to solve many things. For me, it's a clear idea. But a person with lung cancer, which is a metastasis of digestive cancer, he comes to my practice and says, "Doctor, I feel so bad." Colon hydrotherapy, she didn't want to hear not even the word. "I feel so bad because her ankles were completely irritated. But it was terrible with fissures, broken skin, irritated skin, and I had never seen something like that. It was Friday evening, as always. So she was coming from La Coruña, far away from where I lived. So I thought clay patches, and we gave them red clay. We told her how to use it. You know what happened? A week later, she comes with perfect ankles and said, "Doctor, I do whatever you say. Colon hydrotherapy, you can also tell me to go down and fall on my knees and pray. Whatever you say, I'll do." Well, it's a bit the trust they place on you. Of course, we have to have knowledge. Of course, the responsibility of therapists and doctors is high, is strong. We have to have information and also modesty to say, "I don't know about this, and I refer you to a colleague, for example, or come back next week, I'm going to prayer." If I have a lack of knowledge, that's it, and no shame at all. Not only because you have a title or your name on the door, it's my obligation to know everything, and you have the guarantee that I know everything. I'm just human, I'm not divine. Well, I'm divine, but I'm human also. But that's fundamental. No, that's the idea. I think you are relaxed, so why don't you ask another question?